recording. And then we go to so sharing the screen, and we start with the first slide of our presentation. Well, yes, here it is. And as you see, today we are going to speak about, so actually we're starting a new module, and this is explaining and reassuring module, unit 4. And so what we start with is we start with comments on your homework, the assignment which you were given. One of the tasks was to describe the cannulation procedure. And so we were speaking about this, but just to remind you, when uploading the screenshot, make sure to use the correct scale. Otherwise, it's hard for me to read it like this. So because I see only one part of the screenshot, and to read it, I need to scroll up and down, and or I need to download this file to my computer. So just make it just easy for me to read. And also this one, so the scale is very small, that is why it's hard to read. And I also need to download the screenshot to my computer, because I can't just adjust the scale on the site. There is no such an option on the site. Or some students do like this. So how do you plan me to read it? I don't know. Well, and as for the content of the task, so the key phrases that you should have used in the instructions of the cannulation, to the cannulation procedure, so should be like this. Now I'm going to insert the needle to the vein. I would like you to hold your hand still. So you see, there are polite formulas here. When a doctor explains the steps of the procedure to a patient, he uses, I'm going to, now, I would like you, and so on. And the other one, Mr. Alex, could you please adjust yourself to a comfortable position? Yeah, that's it. Now I need you to stretch your hand for me. Also, polite formulas like, could you please, that's it, now for me. Well, and one more example. If you don't mind, can I stretch your hand distally? Okay, thank you. Now you'll feel a tiny scratch. It's just for seconds, so please keep calm. Also, polite formulas are used here. And most of the students understand the difference between describing the steps of a procedure to a colleague, which is given in short imperative sentences, and giving instructions to a patient using polite and simple language. I mean that here on this slide, we have the examples of both styles of communication. So it's marked like number 5. Wash your hands, put on your gloves, and prepare the things for intravenous cannulation. So is this phrase used in the conversation with a colleague, to a colleague, or to a patient? Colleague, of course, yes, sure. Because there are no polite formulas. This is business-like, and we just explain something. We do not care how it sounds. We just give instructions in short phrases. As for the next one, ask the patient to stretch the hand to put the IV cannulation in the hand. So is it to a colleague or to a patient?
Colleague.
Also colleague. Sinju, you know better. Yes, because this is, as far as I remember, your paper. Yes. Yes. And as for the next phrase, I need to put the IV cannulation on hand. So if you could stretch your hand for me, please. Thank you. And this is?
Patient.
The patient, sure. Because this is the person, the doctor addresses this phrase to somebody, to a patient, and we see you, if you could stretch. That is why, of course, for example, Sinju used these phrases: wash your hands, so put on the gloves. But she also added the phrases which should be used in the conversation to a patient with polite formulas. Some of the students did not see the difference between the conversation to a colleague and to a patient, and they didn't use the polite formulas as I asked. Sorry? Okay. That is why you see that the score of some of the students is not just maximum. It's not 10 points, but only half the score, 5 points. So this is the reason why you've got such a score. Well, and now we're going to start speaking about explaining and reassuring. And I would like you to have a look at this picture. And as you see, the picture which is given on this slide, there are some questions. What do you think the patient's reaction to the instruments and the situation would be? Let us listen to Asna.
Ma'am?
Yes, please. Can you answer this question?
This instrument is, I think, endoscopy. And when the patient sees it first time, they will shock. They will have a discomfort because what will do with this instrument, and that so many anxieties about this instrument.
Exactly. So they say, what? This will be inside my body? Yes, very scary. Well, and so what about the doctor's reaction?
The doctors will explain how this procedure will work, and they will explain to the patients how will this procedure will work, and they to say.
Okay, so do we have anything to add about the doctor's reaction? Okay.
Yes, ma'am.
Yes, please.
In the beginning, by looking at the face of the patient, the doctor can understand whether he's worried or he's fine. So seeing his reaction, first he need to console him or to calm him. Later he should explain the procedure in an easy manner so that he too understands without any medical terms or some things. And I think after speaking this, the patient will be calmed down and the doctor can do whatever he wants to treat.
Exactly. Okay, and one more question here. Do all patients react to instruments in the same way? Let's listen to Shamisha.
No, ma'am. every patient reacts to instrument in a different way, because some people causes afraid of some instrument, and they cause this leads to increasing of blood pressure and leads to several problems. But the patients which have a experience before, they feel in a good way.
Exactly. It depends on whether they've had already this procedure or not, and also how they feel. Okay, good. Now let us move to the next slide, and now here we should focus on some aspects of word stress and suffixes. So to the left, you can see, to the left, you can see the suffixes: ectomy, oscopy, ostomy, otomy, and to the right, we can see the explanation of these suffixes actually. And the task is to match each suffix with which describes a surgical procedure to the correct description. Now let us listen to Ramisha. So the first suffix is ectomy. What does it mean? Ramisha, are you here?
Yes, ma'am. Yes, ma'am.
Okay. Try to find
Ectomy means
Mhm.
removal of his structure by surgery.
Exactly. So this is a very just serious surgical procedure, removal. Okay, the next is oscopy, and let's listen to John Farvin.
Yes, ma'am. Option D.
Option B, what is it?
D.
DD?
The act of examining.
Yes, this is oscopy. Can you think of any examples of the names of the procedures that have this suffix? Oscopy.
Endoscopy.
Endoscopy. Okay, great. Well, the next is ostomy, and let's listen to Hala Malik. Yes.
An opening between two cavities or the outside.
An opening between two cavities, and any medical term that has this suffix, ostomy.
So
Who can help us? The word with ostomy suffix.
sorry, I don't know.
Okay, so neither do I, because I am not a doctor. Okay, so but if we just try, we can find such terms. Well, now otomy, the next suffix is for sultan. Hello?
Yes, ma'am.
Hello? What is it?
Hello, ma'am.
Hello?
B option, ma'am. Cutting
Yes.
something open.
And any examples?
Musculotomy.
Okay, lobotomy, yes. Okay, great. So these suffixes are widely used in in medicine. So, and I think that you'll be very so you can meet them very often. And now, if we have a look at the next slide, we can see we should focus on the stress in the words that have various suffixes. And the question is, what is the stress pattern of each of these words? We have three words which are very similar to each other, but they have different suffixes. And let us listen to the pronunciation and then try to imitate the pronunciation and think of the stress pattern here. So I'm going to switch it on and you'll tell me if you hear or not.
Unit 4, Pronunciation. Unit 4. Pronunciation.
Do you hear?
Yes, ma'am.
Okay, now one more time.
Unit 4. Pronunciation. Exercise 3. 1. Endoscope. 2.
Endoscopy.
3. Endoscopic.
Okay, tell me please, which syllable is stressed in the first word? The first, the second, or the third? Endoscope. Endoscope. Syllable number 1, syllable number 2, syllable number 3. Endoscope. Syllable number 1, yes? Endoscope. Yes. In the second word, endoscopy, the stress moves to which syllable? Endoscopy. Yes, to syllable 2, endoscopy. And in word endoscopic, which syllable is stressed? Endoscopic. Three, yes, syllable 3. So you see that depending on suffixes, the stress also can move to another place of the word. Well, and here are the diagrams which describe different stress patterns. And you can see that here the first diagram presents the word which consists of 3 syllables, 1, 2, 3. And the bigger circle describes the syllable which is stressed. The second diagram describes the word which consists of 4 syllables, and the second syllable is stressed. Then in the third diagram, the third syllable is stressed. Now we are going to listen to 7 words, specific medical terms, and you should write these words in 3 groups. So write them next to the corresponding diagram. So depending on the syllable, number of syllables and the stressed syllable, whether it's on the first, on the second, or on the third syllable. Okay. Now let's get started. And you please make notes.
Exercise 4. 1. Endoscopy. 2.
Proctoscope.
3. Gastroscopy. 4.
Colposcopic.
5. Gastrectomy. 6.
Proctoscopic.
7. Gastroscopic.
Well, are you done, or do we need to listen for the second time?
Yes, ma'am.
Once more. One more, please.
Exercise 4. 1. Endoscopy. 2.
Proctoscope.
3. Gastroscopy. 4.
Colposcopic.
5. Gastrectomy. 6.
Proctoscopic.
7. Gastroscopic.
Okay. So which words are written next to the first diagram? Let's listen to Sinju, please.
Proctoscope, ma'am.
Yes, proctoscope. Okay. Now, next to the second diagram, Danish.
Yes, ma'am.
The second line.
Endoscopy.
Mhm. Yes, you're right. Endoscopy. What else?
And
Who can help us?
gastroscopy, ma'am.
Yes, gastrectomy. Yes, and
Gastrectomy.
gastroscopy. Yes, thank you. Okay. And diagram number 3. Let us listen to Ashwati. Diagram 3. Ashwati, are you here?
Yes, ma'am. Yes, ma'am.
Mhm.
3 it comes poroscopy. I think so.
Will you repeat, please? I didn't get it.
I think the 4th one, ma'am, poroscopic.
Yes, yes, this is colposcopic. And there are 2 more words. There should be 2 more words here in line 3. Who can help us?
Protoscopic
Yes. And
and gastroscopic.
gastroscopic, exactly. You're right. Thank you. Well, these are the examples of just different stress in the words.
Exercise
And,
4.
yes, here they are. So if you have like this, so it's good. So proctoscope, endoscopy, gastroscopy, gastrectomy, colposcopic, proctoscopic, and gastroscopic. Very hard for me to pronounce. Well, now let us have a look at the next slide. Here we can see some medical instruments. There are 2 of them, as you can see, the proctoscope and bronchoscope. And so judging by the name of these instruments, and I think that you've heard about these instruments. What is the purpose of these instruments? So you see, the scope means this is the scopy, the process, the act of examining. Yes, and these are the instruments that examine something. What do they examine? Let us listen to Taib. Taib, are you here?
Yes, ma'am.
Okay.
Proctoscope. It's used to examine the insides of rectum and anus.
Mhm. And about bronchoscope?
It is an instrument that is used to see the inside view of our body.
What part of the body?
That might be the nose or mouth. Nose or mouth, ma'am.
Or the lungs, yes?
The lungs, bronchi.
Yeah. Mhm. Okay, yes, all right. Well, and there is one more example of such an instrument or a procedure shown on this slide. As you can see, this is the gastroscopy, and gastroscopy procedure is shown on the diagram on this slide. As you see the, yes, here. And now we are going to listen to an extract from a talk by Dr. Quinn. He's explaining how a gastroscopy is performed. And let us also make notes about the 3 pieces of advice given to patients before the procedure is carried out. So these pieces of advice are about anti-acid therapy, about eating, and about driving. So let us. So let us switch on the recording now. and make notes about this.
Listening 1. Once the procedure is explained to the patient, advice is given about what preparation is required before it is carried out. The patient is asked to stop anti-acid therapy for 2 weeks beforehand, if possible. For eating and drinking, the patient is advised to take nil by mouth for 8 hours before the procedure is done, but note that water up to 4 hours pre-op may be okay. As regards driving, the patient is advised not to drive if sedation is involved in the procedure. A leaflet about the procedure is always given to the patient, and follow-up is also...
First of all, will you tell me, is this procedure described to a patient or to a colleague? To a colleague, yes, exactly. Okay, have you made the notes about these 3 pieces of advice, or do we need to listen for the second time?
Yes, ma'am.
Yes,
Yes,
ma'am.
okay, now.
Listening 1. Once the procedure is explained to the patient, advice is given about what preparation is required before it is carried out. The patient is asked to stop anti-acid therapy for 2 weeks beforehand, if possible. For eating and drinking, the patient is advised to take nil by mouth for 8 hours before the procedure is done, but note that water up to 4 hours pre-op may be okay. As regards driving, the patient is advised not to drive if sedation is involved in the procedure. A leaflet about the procedure is always given to the patient, and follow-up is also...
Okay, so what do we do understand? Let's listen to Labib.
Yes, ma'am.
About
Question is
anti-acid therapy.
okay. The patient is asked to stop the anti-acid therapy.
Yes, so to stop taking some medicine, right?
Yes.
Okay, now let's listen to Hepzibah about eating. What does the doctor say about eating?
Yes, ma'am. For eating and drinking, the patient is advised to take nil by month for 8 hours before this procedure is doing.
Yes, and what about water? How many hours before?
Water is for 4 hours.
4 hours before. Okay, great. Well, and now about driving, let's listen to Ansila.
Yes, ma'am. The patient is advised not to drive if the sedation is involved in the procedure.
Exactly. Okay. And
Listening 1.
So if we just focus on the verbs which are used by Dr. Quinn. So what kind of phrases, what kind of verbs does he use? He says, is explained, is given, is done, is carried out. What kind of structures are they? So the verb structures. Is advised.
Present.
Present, you are right, present. But is it so active voice or passive voice?
Passive.
Passive, exactly. Yes, and if we have a look at the next picture here, we can see the examples of the sentences used in the active voice and in the passive voice. The first one is the cat drank the milk, drank, yes, in the past, drank the milk. And so you see that the cat is the subject of the sentence and the cat did it itself. So this is active voice. And the second picture, when the baby is crying and because the milk was drunk, the baby doesn't care who drank the milk, but the baby sees that the milk was drunk. Was drunk, this is the example of the verb in the passive voice. And the milk is made the subject of the sentence. Well, and So let us refresh what we remember about the passive voice. So these sentences are used in explaining investigations and procedures and passive voice, I mean. So active sentences say who is doing an action. So the focus on the person who does the action. Passive sentences don't necessarily say who is doing the action, though they can do this. And there is an example, there is the formula which is used to make passive voice sentences. If we speak about the present simple passive, so it consists of two parts. The first part is, as you see here on this diagram, is the verb to be. And the second part is the main verb in the third form. And the form of the verb depends on whether the verb is regular or irregular. If it is irregular, for example, I don't know, discuss, yes, we add ed, is discussed. So the passive voice is discussed in the lesson. And if it is irregular, we should take the third form, like write, wrote, written. So is written or are written. The letters are written regularly. And the forms of the verb to be in the present simple, they are am, is, are. If we speak about I am, he is, or they are. Here are the forms. And so let us look here. Here we have the examples of sentences, now positive sentences, and the examples with verbs that do not require objects. By is not necessary here. The active voice sentence says, the doctor attaches the needle to the syringe. The doctor does it himself. And this is the syringe, as you remember. And this is active voice, attaches. The passive voice, the needle is put at the beginning of the sentence. Now it is the subject of the sentence. And the sentence is, the needle is attached to the syringe. We can use by the doctor, or we can omit this. The sentence still makes sense. So when the verb is attached, I mean the verb to be is and attached the main verb. And the note here, we don't need to say who it is done by because it is part of a procedure and it doesn't matter in this case. And if we have a look at the next slide, here we have the examples of negative sentences. Active voice. A doctor does not use a tourniquet in this procedure, does not use. This is active voice. And passive voice, a tourniquet is not used in this procedure. So is not used. This is a passive voice sentence. Well, and so here there are more examples and about with the verbs that require objects, and we need to use by, active voice. Only experienced doctors perform this procedure. Active voice. And passive, the procedure is performed only by experienced doctors. If we omit by experienced doctors, the sentence doesn't make any sense. So that is why it's necessary to use. And the negative structures. Nurses don't perform this procedure. And passive voice, this procedure is not performed by nurses. Well, this is the grammar information, and it looks like, yes. So we need to focus on the exercise where we need to change the sentences describing procedures into the passive voice, and we should decide whether they require an agent or not. But it looks like we have less than 1 minute. That is why let's take a break and see each other in 10 minutes, right?
Okay.
Okay.